I'd like to show you guys some seated variations, and I think I did a little bit of that with somebody, some seated anterior neck work. I think it's a lot better. But the trachea is here. Just to either side of the trachea, there are little fibers. You can feel them on yourself. They are tighter on the left side. There's a little bit on both. Okay. And to start with, and in the book I have it coming this way, but we'll just do it from here. You just want to kind of lift and feel the integrity of the front of the neck, really platysma. And you really have to get quite far on Erica to feel any. So there's a little resistance there, but it's very minimal.
When you're lifting, there's no downward. It's straight. This way.
Yeah, man. As in terms of pressure on the trachea, it needs to be.
Right. I'm just saying you're just moving straight up. Yeah.
Lifting up.
Yeah. I'm just verifying.
I know the pressure.
Yeah. Oh, yeah.
Think about.
I haven't seen you do it two-handed. You used to do it. You used to
And I will.
and rubber hands. Yeah.
Mm-hmm. Yeah.
Moving it side to side, well,
And this
move it side to side to this neck, put it side to side, make it feel like-
Popping in there.
Yeah.
Yeah,
Mhm.
I clicked
Yeah.
it. I move it.
Yeah. So the highway work will help with that. Should help with that.
Well, and then,
Reduce the clicking.
But I don't feel those fibers you're talking about.
You will. We'll come around and do that.
but then,
All right. So what you guys want to do once you find those fibers is you want to go in and you want to start with just some deep compressions on this. So I'm using more pressure than I was, but it's still not a whole lot. We're just going in, compressing these muscles here. And they're really not super tight on Erica. There's a little bit right there.
You're superior to the actual trachea or anterior to the actual trachea.
I'm right on it. I'm on the cartilaginous rings of the, I'm on it, right on it. Yep.
So you're pinning it against that, or gotcha?
And your other hand is just kind of holding it.
Just holding it there because if I don't, it'll move. So all of a sudden the pressure's gone. So if I bring a hand in, I can create a little wall there. It should be fine to swallow, but if they're weird about it, you can move your hand.
No, it feels like there's just like a knot going down. It's like I'm swallowing something pretty, like a pill or something.
So there's more tension on this left side. Can you feel the difference on this side? It's sticking, both the muscles are sticking to each other, but they're also sticking to the trachea. Yeah, that's, you guys all looked at the picture?
So what muscle are you on? This long one right here?
Sternum.
Right now I'm on thyrohyoid and sternothyroid.
Okay, so that's all the same fascial tissue, right?
Yeah, they're with the pad of a finger, I cover almost all of them. I mean, it's a very.
There's not much of a distinguish here between those two muscles.
The only one you can specifically isolate is omohyoid, and that's out near the scalens.
This is the long one.
Yeah, but it attaches on the scapula. So you can, when you go into the thoracic outlet, you can find. If you guys have ever done scaling work down here and you're like, what is that rope going that way? That's omohyoid.
Oh.
Yeah. But up here, it's all just kind of a mass. And this is the only spot with Erica that's... So what I will show you guys on Erica, and I'll do it over here so the camera can get it, is we should be able to... pick up and compress her hyoids. So I've got her hyoids right there. Oh, and they want to fall. That's them right there. That's a good time. So we've got a good compression there on those. When we get them, they want to
It's more
fall.
about lifting than squeezing, correct?
Okay.
Dave, more about lifting than squeezing.
This one's, you can get some squeezing in there.
No, I know you can,
Oh, yeah.
but are you doing more lift than squeeze, or are you doing about
I'm not so sure it's really one or the other.
so equal pressure? Okay.
Whatever you feel like you need, man. You know, lift as much as you need to get them, and squeeze as much as you feel is therapeutic. Yeah, but you're not going to be able to do this on everybody, just so you know. Then some people you got to really loosen up those hyoids. Hers are pretty loose.
Yeah, I mean, the fact that you got that much underneath,
Okay.
and like guitar strings and some people, it's like,
Can we keep going deeper? Let me know when I need to stop with Just lift your right index finger one more.
Never anybody touched more than me. Now I did.
Let's do the next one. Ooh, we don't like that.
Sorry.
It's okay.
Touched as much as me. No, I-
It was pretty funny.
Yeah, I was like, hey.
All right, so again, to do this right, you have to get a, so just notice where my investment is. I'm just on the front side of SCM. That's where I start my lift. If you don't start that deep down, you won't get them. So I've got them right there.
Oh, wow, yeah.
If you
Just
start,
roll off SEM and you're right on it.
yeah, if you start too shallow, you won't grab them. You have to start pretty deep and lift up. We got a good spot here.
You feel it on yourself, right? You feel the volume and everything. Right?
Good.
Is there anything breathing wise that I could do to help?
Slow. Fast breathing will make them drop back. So just slow, deep if you want, but just slow breaths. Make sure they breathe slow. Yeah. But those three things are about all you can do. I'll do some seated stuff in a minute with them. But yeah, just make sure you hit high always. This gives you access to longus colli and capitis, which again, I don't think is a big need for Erica because her neck is really open. We're just going to treat them because, it's part of the demo. If anything, her upper fibers are going to be tight. We'll see. So to do this work, we do have to move the trachea. We have to displace the trachea and go in.
So you don't hold it with the other hand.
No, we want to move it.
So try to move first. If it doesn't move very well, you may try to loosen up on both sides first to give it some loosening. And if you bump into somebody like me, there's no problem.
So it's wrong to hold it or like has cracks and craziness in it.
Yeah. And so with Erica, I can probably push it and get in there. She's got some resistance with getting in there. So I'm going to just do
shifting we saw. Could that also be some of the longest capitis? Could that be pulled, like if it was pulling?
not so much.
Because you said she was shifting. One side was a little bit more, had a little more tension, or whatever you want to call it. Could that
Way more scalene than colon capitis. Colon
I
capitis are
understand.
so far.
It definitely scaling, but I'm saying if we found like she was in an accident, we already know that. If she came on one side, that's a
with the whiplash,
type
yeah.
of thing.
Sure.
So it could be affecting it not bilaterally, but only on one side, and be
Sure.
affecting it as well. I mean,
Yeah.
I'm just
It's
a question.
Yeah. Yep, absolutely. Okay, so we're going to do coli and capitis. I'm going to try to just make my way in here with her, but Erica's going to do much better seated. But if you notice how the trachea moves to the side, are you okay? Okay. We want to make sure, she's got a very strong pulse, so you're going to feel a pulse, and that's fine. But you got to get medial enough right there. So that is her colon capitis, all right? Mm-hmm. So that right there. If you want to be sure, you can have them bring their chin towards their chest just a little bit, and it will contract, but we're good. So you don't want to initiate a lot of talking on their part. Just have them breathe. So, but people that get in there and they'll ask them questions. Don't do that. Just kind of.
So how was your weekend? I need you not to talk.
Have you done some fishing lately?
Shh, I need you to be quiet, hon.
So there is tension in here. There is some tension in here.
And you might want to locate the whole bone on your
Yeah.
side.
Ground.
Oh, your belly. Okay. Let it grow. In the East, they believe that tummy growling, it means that your body is processing change. That's what I always tell people. They're probably hungry most of the time, but I just tell them that because I think it makes them feel better.
Yeah, going from full to hungry. That's a change.
They're parasympathetic.
That's true.
This is longest collie, longest capitis. It's deep to those. Yeah.
Throw it out of the way. You can't see that.
Good. So again,
So
just
you
so.
stay still, you don't like move.
Oh, I'm moving the whole time.
Oh, you are?
Oh yeah, I'm moving up, giving her lift. So I'm in there and I'm going up. Yeah.
Usually tighter north.
But
Are you usually tighter?
and you can also go higher, but just be aware, guys, how far in you have to move the trachea. So I'm almost midline. You see how my fingers are almost midline? That's where I go in. If you can't get that amount of movement of the trachea, you're not going to get to choline capitis.
David, I want you to work. Can you see the other side and see if that is affecting it? Just palpate and see if the other side was more contracted than the
Her left side?
Yeah, the left side was more than the right.
Not at the same time.
What?
Not at the same time.
No, I mean, I'm just saying,
No, I
it's
thought you were-
because of the accidents you're talking about, was one side more contracted than the other, or are they equal? I don't know if you can-
There's more scar tissue on the left side.
So could that be affecting, and that was my question, could that be affecting part of the whole situation with their neck we were seeing? And the answer is perhaps. Definitely with scar tissue, you're saying.
I'm just answering the question.
And with those muscles being so deep, the capitis and coli give her the appearance of having an open neck because of the way it kind of, it's allowing the other muscles to be loose because those are so tight that it kind of gives her the.
Well, I think she's still got good integrity there. She's just tight, you know. She's tight, but she's got. The thing is, like, tightness doesn't tell us a lot. It doesn't tell us that. You know, I guess what I'm learning over time is severe forward head posture can be from lots of hypertrophy, but a lot of times it's, which I think is the case with Marcel, because his spine is starting to fuse at that position because he's old.
So you don't have it.
But
Is what happens if you hold the fire?
But-
You're completely wrong by move, like when I move it and I go like that. Like I hold it.
you don't need to move the highway yet. You just move the
I mean,
trachea.
not the the trachea. I hold it with my other hand now.
Sure.
Oh, it's okay to.
If that's how you want to do it, absolutely. Yeah. I like to do it with one hand. Yeah.
Okay.
Yeah. You can do that. Sure. Okay. I'm going to come back into a seated technique for this because I think that will help. But just make sure that you get enough displacement of the trachea. This one you're going to have to practice. But again, with whiplash cases, very, very important.
And there are some people who won't let you do that, period.
Okay. So moving on to scalenes. Hyoid bone, right in here. All right. That's Erica's right there. And you have a ton of muscular attachment on the outside of your hyoid.
Does it make anybody cough or is that?
This side's tighter. And the tendon.
On the right side. So what I'll do is I'll bring my thumb on this side just to hold the hyoid bone, and on the other side I'll come in and do work right on those muscular attachments. Again, it's not real deep, but you just want to try to. And even this far out, I can feel her pulse. She's got a very strong heartbeat.
So you're just compressing that? Is that what you're doing?
You're alive, you are.
You're just doing a little light compression there?
Light compression, yeah. Light compression. Right on the hyoid bone. A little bit of slow friction, I guess. It's not really anywhere you need to move the tissue. Now I can pin it down, like so, and then have her swallow.
What side are you working on, the left or the right?
Both. On this one, I'm gliding down both,
Both
yeah.
your glide. Okay.
Or I can say bring your chin to your chest. And just stretch it out a little bit, but mostly it's just compressions right on the edge of the hyoid bone. Okay. So now moving into scalings. So from where my thumb is, you can access middle scaling, you can access anterior scaling. Posterior scaling, you have to get down here. So we'll go through each of those. You have a lot of options here. Traditional neuromuscular thought is just to go in and compress and do frictions. And you can do that, but I'm not the biggest fan of that. Compressions are okay. How tight is that in there? Is it okay? Pretty tight? I like to pin and stretch. So what I'd like to do is find the layer I want to be on, stretch down. Make sure I'm getting here. I want them here. Thank you. Okay, so from neutral, and this is middle scaling, find middle scaling, pin it down, and then I can have her move or I can passively move her. And we're just pinning and stretching.
It's really tight.
If I wanted her to do that, yeah, I mean it's tight. It's pin here, and then if you can slide your ear towards your shoulder for me. There we go. She's adding some rotation, which is good. Scaling's rotate as well. Here. And you can come back to me. We'll do one more. So, again, flats of the fingers. This is not fingertip. This is flats of the fingers. Go in, pin the tissue down, and then have them move. So slide your head again to the left. Back. Good. All right. From there, we do want to think about getting the thoracic outlet. Ribs 1, ribs 2. So I like to bring the head towards the side I'm working just a little bit and compress it in. Okay. So I'm right in towards first rib. Scalenes are very lateral muscles, and what I mean is they're right in line with the neck. They're not really too far forward, too far back. They're right in line with the neck itself. So I'm just compressing straight in there with the thumb. I could also stretch from here too.
You're not middle scaling still?
Yeah, middle scaling. Now, some of that upper rib stuff that we did yesterday, I really enjoy doing this with the upper rib work at the same time because it's so integral. So I'll get in and work the ribs while I'm working in the thoracic outlet at the same time. All right, and probably the most important scaling technique is for posterior scaling, and most people don't treat posterior scaling. If you want to treat that muscle, you've got to move trap, go around to the back of the neck, and that is posterior scaling there. Okay. So C6 and C7 to the back of the second rib. It's a very low muscle. It's not in C5 and up, it's not there. You need to be going towards thoracic spine if you want to hit it. What most people hit is typically elevator scapula. They don't hit posterior scapula. And when you hit it, they'll feel referrals a lot of times up their neck or down into their shoulder blade.
And the arm?
Sometimes, yeah, if you're hitting, because scalenes do go not too far down the arm, but they can.
Yeah, I felt going
Up the neck.
here.
Very often it refers second, third finger.
Cool.
And even if it doesn't, you tell them don't worry if it refers to the second and third finger, and they tell you yes it does. Even if it doesn't, it's funny sometimes.
You put it in their head.
Yeah, really.
Sorry.
It's music. It's not.
It's a white noisemaker.
We'll leave it as okay. All right, so let's have you slowly slide your neck again to the left, nothing too fast. All right. I always ask if people are all right, as though if they weren't all right, I would stop. I just ask it so they know that I'm aware that they're going through something. That's fine. Just take a deep breath in. Okay, let's have you sit on the edge of the table for me. So before we move to jaw, I want to make sure, I think I covered all the techniques: hyoid, infrahyoid, coli capitis, scalenes. This is not in the book, but this is has become my preference in treating these muscles seated. And I think the reason is just gravity. I'm able to get, so if we did right side, we did a little both, but anyway. So if Erica brings her chin slightly towards her chest, just a little bit down, it gives me great access gravitationally to her coli and capitis right there. Really good access, and it actually tends to be a lot more comfortable for them. I can pin down and have her look up. So slowly start to look up for me. And that will really create a deep stretch in the neck flexors there. Whoever works in Erica, you're going to find she's challenging, man, because she's slightly hard to access, and her pulse is so strong. I mean, it's like right there.